It has to do with our breakdown of the ketone bodies when we are fasting, and it's the hydroxybutyrate that blocks the inflammation because those levels increase because it's breaking up the ketones when we fast. Hey, what's up, fasters and health enthusiasts? Dr. LeGrand here for another video, and this is also another video where I am going to be answering one of your guys' questions that I just posted a while back, asking what videos that you guys wanted me to post on. So this question comes from Diala, if I'm saying that correctly, and they asked, what are the effects of fasting on joint pain or arthritis? I did do a video about this a long time ago, actually. It was one of my first videos about how fasting can reduce inflammation, especially for arthritis or joint pain. Now, to kind of go a little sciencey here for just a minute, bear with me. When you are fasting in a fasting state, we do know that you start breaking down ketone bodies, right? So breaking down the fat cells, we're using that source for energy. The body switches that, using that as a source of energy. What the beauty about this, especially for joint pain and arthritis, is that this particular process, when it's breaking down these ketone bodies, there's a particular ketone that's called hydroxybutyrate. Now, hydroxybutyrate is actually known as a precursor to block inflammation, specifically inflammation, which is a precursor to the inflammation in our body when that's recurring. So when you are consistently fasting, and I know you're going to ask the question, okay, so how long does it take to get in that state? Well, how long did it take to get into ketosis? So this does depend on the person. I've talked about how long it does to get into ketosis when you're fasting. This could be as soon as 16 hours, depending on what your diet was beforehand. So if your diet was more keto-based, where it had low carbs, then it's going to be easier to jump into ketosis when you are fasting. So it only takes you 16 hours. But if beforehand you had a high carb diet, it might take you 24 plus hours before you reach ketosis. But the thing is, people get hung up of trying to say, okay, then that means I need to fast for several days in order to get this benefit. I always say small is better in a long term. I always think it's better to change things that are more of a lifestyle change. And what I mean by that is you think about just changing a simple thing in your diet, right? If you change a simple thing in your diet, whether that's, okay, I'm going to eat a little bit more vegetables every time I eat dinner, okay? By just changing that simple thing and doing that throughout several years, because it was easy to change, just adding a little bit, right? You're able to adjust that, and it's going to improve your health over the long run. Versus if you extremely change your diet, just went completely vegetarian, no carbs, anything like that, and then you did that for only like 3 to 4 weeks, and then you just went back to what you normally ate. Sure, during that time it did great for your body, but really in the long run, not so much. Same goes with fasting. When people decide to do a 7+ day fast and they call it good, great, it was benefit at that meantime, did a little benefit for your body, but in the long run, I'd rather preferred you every week doing a 24, 36-hour fast weekly for the rest of your life, okay? So the same goes with inflammation, arthritis, joint pain. What I tell my patients that come in with chronic pain, joint pain, or arthritis, now it depends. Now, if you are dealing with a more deteriorating condition, where your body, you're dealing with more osteoarthritis, stuff like that. Fasting, it depends. It's not always the best option because your body might be deteriorating. You might be also very low on minerals, electrolytes. So fasting at that point might not be a good option. What you need to do is actually increase as far as minerals, bone minerals, increasing different nutrients in your body to build up first, because that could be an issue and you don't want to necessarily incorporate fasting. But if it's just standard, joint pain, you're overweight, you're not in a, where your body is deteriorating a lot, then incorporating fasting on a regular basis where you're doing probably 36-hour fast, that's how long you want to be doing to be able to increase the levels of hydroxybutyrate to be able to block off the inflammation. But another thing that I do suggest for every person that is dealing with inflammation is to always be taking a natural anti-inflammatory on a daily basis. So things such as boswellia, curcumin, and quercetin, all three of those are great things. Also, skullcap is really great for reducing inflammation. On taking that on a daily basis is great. Especially if you deal with really low back pain like I take that on a regular basis, and it's kept really my inflammation far, along with doing fasting. So as long as you do that, start incorporating fasting along with taking some anti-inflammatory. But another thing that I will mention is also the foods that you consume. So a lot of times, depending on what state you're at, it really depends on the person, because I don't think one diet fits all for everybody. Everybody is individual. That's why I like to focus for a lot of my patients. But if you tend to have a lot of gout, chronic pain, you tend to be overweight, have high blood pressure, or diabetic, where you're kind of that metabolic syndrome going on, then a more vegetable base is going to be definitely better for you, especially for inflammation, bringing down the swelling, edema, along with fasting. Incorporating those two things is going to be really great. Now, if you tend to be somebody that's a little bit more on the deteriorating side, doing more of the keto diet, that's a little bit more build-up because it incorporates more proteins and healthy fats, along with fasting, would be also a good thing to incorporate those two. So that's, I hope that answered your question as far as, how does fasting work? Again, to reemphasize or summarize, it has to do with our breakdown of the ketone bodies when we are fasting, and it's the hydroxybutyrate that blocks the inflammation, because those levels increase because it's breaking up the ketones when we fast. So it could also happen even when you're in keto, but as we do know, obviously you're going to be in higher ketosis when you fast versus doing the keto diet. So if that did not answer your question, go ahead and leave that in the comment section below. You can also DM me. And for anybody watching, if you have more questions about fasting, inflammation, arthritis, and joint pain, go ahead and leave that in the comment section below. And if you are new here and want to know more about fasting, health tips, alternative medicine, natural medicine, go ahead and hit that subscribe button and hit the notification bell so you don't miss out on any other future videos. I'll also leave some playlists here that you can check out. Until next time, this is Dr. LeGrand signing out, and I will see you in the next video. Thanks. Bye.